I'm Joseph Coselli, and I am Chief of the Division of Cardiac Surgery for Baylor College of Medicine, and also Director of the Thoracic Surgery Training Program. When I finished my undergraduate work at the University of Notre Dame, I wanted to be a heart surgeon. I grew up here in Houston. I knew at that time, being a Houstonian, that if you wanted to go into heart surgery, the single best place you could do that was at the foot of Dr. Michael DeBakey. When I finished my training here, I spent 5 years doing general surgery with Michael DeBakey's surgery program. I then stayed and did a cardiac thoracic surgery residency, which was another 2 years. Following that, I was invited to stay on the faculty of Baylor College of Medicine in DeBakey's Department of Surgery. And the individual that I worked with and was mentored by and spent 7 years, basically every day working with him was a fellow by the name of Dr. E. Stanley Crawford. Dr. Crawford was one of the godfathers, pioneers, etc., of surgery on the aorta, basically of all kinds. And so I spent all that time working with Dr. Crawford, and if you didn't go into it loving the aorta, you certainly came out that way. My specialty is on one of the structures in the chest that's maybe a little bit less commonly operated on. The most common operation that heart surgeons do is bypasses on the coronary arteries. But the large artery in the chest, which supplies the blood to the entire body, the arms, the head, the lower body, and the legs, is the aorta. And the aorta is subject to quite a number of different pathologies and problems, the most common of which is dilatation, which would then be described, or we call them aneurysms. That's what I spend most of my time doing, is operate on patients who have aneurysms and dissections, which are tears of the aorta.